What is the treatment for cervical myelopathy? Cervical myelopathy is the pressure on the spinal cord in the neck, or what we refer to as the cervical spine. A lot of the treatment depends upon the number of levels involved. If it's less than 3, typically surgeons, like myself, go in through the front of the neck through a small incision about the size of your fingertip. The options include a cervical fusion, in which a plate and screws are applied to the spine after removal of the disc space, or an artificial disc replacement, which functions as your normal disc would, allowing bending forward, backward, and side to side. In general, my preference is a motion-preserving procedure, particularly a cervical disc replacement for the treatment of myelopathy if it's less than 3 levels. Now, if you have more than 3 levels of disease and there are multiple sites of pressure on your cervical spine, then surgeons like myself like to go in from a posterior approach, an incision in the back of the neck. The options include what we call a cervical laminectomy and fusion, which involves removing the lamina or the bone that you can feel on the back of your neck, removing the pressure on the spinal cord, and then placing screws and rod to fuse the segments. It's my preference for a posterior approach to undergo a cervical laminoplasty. A cervical laminoplasty involves the use of small plates that open up the spinal canal, alleviating the pressure on the spinal cord. And the key difference is that it allows preservation of your neck motion, so you get to keep on moving your neck as you did before surgery. Regardless, cervical myelopathy is a surgical treatment and disorder, and you should see your spine specialist.